Good afternoon to all the higher dignitaries, my colleagues and students connected with me for today's session. I, Dr. Shivali Singla, Professor, School of Pharmacy, Abhilasha University, welcomes you all in this talk session on applications of compartment modeling in pharmacokinetics. Before moving to our topic, today's session, I would like to thank Abhilasha University, our senior librarian, Mrs. Neelam, our technical support staff, Mr. Manoj, and Ms. Nitika ma'am for providing me this opportunity. Welcome you once again. Now coming to our today's talk session, that is applications of compartment modeling in pharmacokinetics. Here, uh, before going to today's talk session's main topic, first of all, I want to introduce pharmacokinetics to you all. In today's scenario, we are living in the words of medicine or word of drugs. Today's time, a lot of medicines, new medicines are emerging day by day. Every day a lot of medicines are coming into the market. Do you ever think about that, how these medicines coming into the market, how they get developed, how it is decided whether it is to be taken by oral route or intravenous route, means by injection or anything else, or either it is to be taken as a capsule or any other dosage form. The story behind all these things start from the pharmacokinetics, that is the drug traveling from the site of administration to the bloodstream to the receptor or to the site where it get acted or it start its process of pharmacological activity. So let me to introduce to you all about the pharmacokinetics. First, I am going to start with the oral administration of a drug. There are a lot of routes for drug administration like oral, parenteral, via skin or via nasal or via ophthalmic route. But the most convenient route or most used route is oral route. It is always extravascular route, it is also called as. So whenever a person is taking tablet, capsule or anything else by oral route, first it goes into your stomach, that is gastrointestinal tract. Here, after reaching to gastrointestinal tract, it gets dissolved there and reaches to blood circulation. Here is the first step for pharmacokinetics, that is called as absorption of the drug. Means in the journey of drug travel from its site of administration to the activity of the drug, first step of pharmacokinetics is its absorption from its site of administration. Now the drug is introduced into your bloodstream. Bloodstream is blood is a connective tissue for all the tissues of the body. Now blood circulate this drug or medicine into throughout your body. Body comprises of a lot of tissues. This process is called distribution, means from the blood circulation when drug reaches to all the tissues, this distribution process in pharmacokinetic language is called distribution. Here, the drug get also distributed into liver as well as lungs, heart, brain, skin, and all other tissues of the body. These all tissues contain some receptors where drug get binded to these receptors, show its activity, but for long time if drug retain into your body, it will be toxic for the body. So body has a process to biotransform it from one phase to another phase, that is called as biotransformation or metabolism. Means that is the third step for pharmacokinetic, that is called as metabolism. Metabolism means breakdown of the drug or conversion of the drug from one phase to another phase, which is liable to excretion, means completely removal of the drug from the body. Now, when drug get metabolized, means it get converted in from one phase to another phase, second phase, that is less toxic. Now it goes into kidney, that is the excretory organ of our body. With the help of kidney, the drug get completely removed from the body, that is called as excretion of the drug. Here, this is the fourth step in the journey of pharmacokinetics or in the journey of drug in the human body. So again, I am repeating, pharmacokinetics comprises of four major steps, that is ADME, means absorption. First, that means drug moves from site of administration into the blood circulation. Second is distribution, when the drug get distribution throughout the body. Then third, drug get metabolized, means biotransformed from one phase to another phase. And last, excretion. Excretion means drug get irreversibly removed from the body with along with the urine. These are four major steps of pharmacokinetic, which are very much important in the development of a drug. Means these four data, if we know how much drug get absorbed, how much drug get distributed, when and whether and how it get metabolized, and how much is its excretion is there, we can formulate it outside the body, whether it is to be given by oral route or parenteral route or any other route. So let me to explain with a flowchart to all these processes. Here, first step is drug administration, a person who is taking drug by any route. Second step is drug absorption. Then third, drug get distributed into various tissues. Here, the drug can get into metabolism or drug get eliminated through from the body. Then drug binded to regulatory proteins, bind to molecular targets, and there is a response of the drug. Response means the drug when get binded to some receptors or some target sites, it will exert its effect or show its effect. That comprises pharmacodynamics. Here we are talking about pharmacokinetics only, not on dynamics, because these four parameters only decide the fate of the only decide the development of the drug, which are important for R&D or which are important for making the drug coming into the market. Means before coming to the market, we have to calculate four major parameters of the drug and along with all mathematical calculation. So coming to our main topic, that is compartment modeling. Compartment modeling, it is a type of pharmacokinetic models. So here I am explaining about pharmacokinetic models. Basically, a model is a hypothesis that employs mathematical terms to concisely describe quantitative relationship, or mathematical models are a collection of mathematical quantities, operations, relations, together with their definitions, and they are realistic as well as practical also. But in the case of pharmacokinetic modeling, it is a tool used to help drug developers understand a drug's effect on the body by analyzing its absorption, distribution, metabolism, and excretion. Combinedly, they are called as ADME properties. Means by the use of pharmacokinetic models, we assess its some mathematical parameters like absorption, how much drug absorbed, and what is the rate of absorption, how much drug get distributed in different tissues, means how much drug get distributed into liver, how much it is going to brain, either it is going to brain or not passing the blood brain barrier, how much drug get metabolized and what is the rate of metabolism, and how much drug get excreted in how much time, and what is the rate of excretion. These all parameters can only be calculated with the help of pharmacokinetic models. Now, a lot of pharmacokinetic models are there. We can classify mainly these models into three types. First is compartment modeling, that I am going to elaborate. Second is non-compartment modeling, and third one is physiological models. Here I am going to talk about only compartment models, because compartment model is the traditional and most widely used approach to pharmacokinetic characterization of the drug. These models simplify, interpolate the experimental data, and allow an empirical formula to estimate drug concentration with the time. Means when a person is taking a drug, and we withdraw blood samples time to time, and with the help of concentration of drug into the blood, we can comprise a lot of data which are related to ADME directly, means which are related to absorption, distribution, metabolism, and excretion. With the help of these parameters, these data, we can plot a graph between time versus plasma drug concentration, and we can find out the exact concentration. Those we can calculate from these data, and other parameters we can calculate from these data. A compartment is a group of tissues with similar blood flow and drug affinity. Now, the word compartment here, why it is called as compartment modeling? In compartment modeling, a group of tissues means, if body we assume a single compartment, then it is also a compartment. But a group of tissues, if we distribute whole body in different tissues, then one tissue or a group of tissue comprise a compartment. Means we assume in the case of compartment modeling, we assume body into different compartments, or a single compartment, or two compartment, or three compartment, based on the profile of the drug, based on the properties of the drug, and how it react in the our body, how it travel in the our body. That is the basis for assuming compartments. Now, classification of compartment models. On the basis of medication distribution patterns immediately after administration, means when a person taking medicine, immediately after medication, how much drug get distributed, and pattern of drugs distribution decide how many compartments we have to consider for calculations. Means the human body is considered as a compartment. This will determine how many compartments will be used to compute different pharmacokinetic parameters. There may be one compartment, there may be two compartments, there may be three or more than three compartments in which body can be divided, and according to that, parameters can be calculated for that particular drug or that particular medication. There are three main types of compartment models depending on the number of compartments. First is one compartment open model, two compartment open model, multi-compartment open model. Means if the body is assumed as a single compartment, means all the tissues are same and drug get distributed into all the tissues in same pattern, then it is called as one compartment open model. Open word is used because it is thought that drug can enter into the body, and body is open to excrete out it from our body. That's why it is called as open model. Two compartment means there are two group of tissues in which drugs behavior is different. Means one group is different and second is group different. So the parameters can be calculated based on these two compartments, not only based on single compartment, because this time the drugs behavior is different from a single group and from for a other group. Multiple compartment open model. If the drugs behavior is different in all the different compartments, then whole body is assumed as a different, means all the tissues are assumed as a different type of compartment, and all the parameters concerned to it are calculated accordingly. Now let me to explain these models with the help of a diagram. Here here you all are seeing a drum, that is the indication of human body. Here the drug is entering into the body, and this drum means this human body act only as a single compartment. Means the drug when enter into the body, all the tissues it get distributed in the same pattern. Here again, same diagram, it is showing that drug is injected to the patient and it get distributed into the whole body. Means equilibria obtained immediate after the administration of that drug. In the case of two compartment, In the case of two compartment, drug enters into the body. Here it is a single compartment, and second one is the another compartment, that is called as second compartment. One here is called as central compartment and second is called as peripheral compartment, because central compartment is always blood that is carrying the drug. and it distributes the drug into some other tissue, but it is a reversible process. The drug goes into the peripheral compartment and it come out into the blood again for other processes like metabolism and excretion, etc. Here, the same diagram is showing when the patient is injected with a drug, it gets distributed into highly perfused tissues, and second is central compartment. But after some time, it will be attained. This effect is only for immediate after the injection. So immediate after the injection, if drug's behavior is different for different tissues, then it is called as two compartment open model. If drug's behavior is different for all the tissues, then it comes into the multiple compartment modeling. Now we will start from one compartment open model. Here it is shown, a box is showing a single compartment, human body, it is representing. Here we inject a dose or give a dose by oral route or any other route. It reaches to blood circulation and it get eliminated or excreted from your body. One compartment open model having a characteristic, it is a simple way to explain the drug distribution and elimination in the body, as body is assuming as only a single compartment. So it is the simplest model, and the parameters calculating in these models are very simple and easy to calculate, because no different parameter need to calculate as in two compartment or multiple compartment models. For whole the body, we have to calculate a single group of parameters. Second characteristic is, in this model, the body assumes as a single uniform compartment in which drug can enter and exit the body. Means in this compartment, as the drug is entering, and it is open to exit the drug from the body also. That's why it is called as one compartment open model. The drug elimination start from the body, means from the compartment, immediately after appearance into the bloodstream. As the drug appear into the bloodstream, its excretion as well as elimination starts immediately. Elimination comprises metabolism and excretion. Both are included in elimination. ठीक है, again I am explaining it. One compartment open model. Here is the dose, here is the body, that is a single compartment. It assumes whole human body as a single compartment. It is the simplest approach to calculate all the parameters. In this parameter, body is assumed as a single compartment and drug can enter as well as exit from the body. As the drug appear to bloodstream, it can be its elimination started immediately after entrance into the blood. Now because it is a mathematical model, we have to assume some parameters for it for calculation of our parameters. In one compartment open model, first we assume that absorption follows first order kinetics. Means absorption is concentration dependent, it is in passive manner, and it follow first order kinetics. Second is plasma and tissue level of the drug are proportional. Means drug that is present in plasma and tissue, that is directly proportional to each other. It is a dynamic equilibrium is attained instantly. Means in one compartment open model, whole the body equilibrated with the drug immediately after the administration. Again, elimination of the drug also follows first order kinetics. Means that is also dependent on the concentration. Means when the drug reaches to blood circulation, in the blood, concentration of drug decide the rate of elimination from human body. Here, one compartment open model. First step to calculate its parameter is its input, that is called as absorption. Now the drug reaches to blood circulation and other body tissues. Here, output is called as elimination, that comprises metabolism and excretion both. Now, one compartment open model can also be classified into further different categories based on the rate of input or method of input. One can use parenteral, one can use tablet, capsule, or any other route of administration. So, based on this route of administration or rate, in our words, it is called as rate of input or method of input. One compartment open model can be classified into four categories. First is one compartment open model, IV bolus administration. Means when the drug is taken into the form of injection, in a single dose, that is called as IV bolus. One time single dose, if it drug administered, then the parameters will be calculated according to one compartment open model IV bolus administration. But when the drug is taken in the form of IV infusion, means these are large volume parenterals, injectables, IV infusion, if we are using for a dosage form, then the parameters can be calculated via one compartment open model continuous IV infusion. Now coming to our extravascular route, that is oral administration, one compartment open model extravascular administration, zero order absorption. When the order of absorption is zero order, and second one compartment open model extravascular administration when the absorption process follows first order. In so zero order process, the rate of absorption did not depend on concentration of the drug, but in the case of first order absorption, the rate of absorption will always depend on concentration of the drug. Zero order case can happen when there is a receptor or there is a active site present for the transport of drug or absorption of the drug. At that case, one compartment open model extravascular administration zero order absorption model can be used to calculate our parameters. Now, starting from the first method, input method, one compartment open model, IV bolus administration. Because in the IV bolus administration, rate of input is 100%. There is no absorption phase present. Rate of absorption, no need to calculate rate of absorption because in a single injection, all the drug get introduced into the blood stream. Now blood has to distribute all the drug into different tissues. So here parameters to be calculated are elimination rate constant, elimination half-life, clearance, etc. Next one is one compartment open model IV infusion administration. Here the drug reaches to blood circulation but at a zero order infusion rate because drug is continuously introducing into the bloodstream but it is at a fixed rate that is fixed by dripping it or by cannula. Here the parameters to be calculated are apparent volume of distribution, elimination rate constant, elimination half-life and total clearance. Next one is one compartment open model extravascular administration zero order absorption. Here the drug at extravascular site, it get absorbed into the bloodstream by zero order process. It reaches to blood circulation and then distributed and get eliminated. Parameters to be calculated are apparent volume of distribution, elimination rate constant, elimination half-life, total clearance, etc. Next one is one compartment open model extravascular administration, but it is the time for first order absorption. Most probably drug goes into the this model because all the drugs which we are taking by conventional route, that is oral route, tablet, capsule, granules, any other pill that goes into this model. Here the drug at extravascular site, it get into the blood by first order absorption process. Here we have to need to calculate rate absorption for absorption as well as rate constant for elimination. Parameters to be calculated are Cmax means maximum concentration into the blood, Tmax time to reach maximum concentration, first order absorption rate constant, apparent volume of distribution, elimination rate constant, elimination half-life and total clearance. Now coming to our next section, that is two compartment open model. This all till the time this all talk was about one compartment open model when the body was assuming as a single compartment, not the time when the drug's behavior is different for different tissues. Means now the body is reacting as two compartments. Here one is central compartment, that is blood always, and the second compartment, that is peripheral compartment. This is also called as tissue compartment. Means when the blood get into the blood, it gets circulated into different tissues at a different rate. Means equilibrium is not reached immediately after the administration of the drug. It reaches after some time of the administration of the drug. That depends upon drug's behavior. Here we have to calculate many more parameters which we haven't calculated in one compartment open model. Means here we have to calculate parameters for this compartment, second peripheral compartment also, in spite of calculating parameter only for blood circulation. Here in two compartment open model, all the parameters are to be calculated differently for the central compartment as well as for the peripheral compartments, because drug behavior is different in both of the compartments. Next, moving to multi-compartment open model. Body is made up of many groups of tissues, each having a different level of blood flow, different affinity, and rate of equilibrium. Because of this model, each tissue is considered to be a compartment, and the parameters are independently determined depending on the each compartment's blood flow rate. Means here, if we talk about lungs, if we talk about kidney, heart, blood, body is assumed as it contain different tissues. Means brain is a different compartment, heart is a different compartment, kidney is a different compartment, liver is a different compartment, and skin is a different compartment. Now the parameters of the drugs, pharmacokinetics or related to rate constants are calculated based on the blood flow, first and second drug's affinity to a particular tissue. Suppose drug is highly lipophilic, then its affinity towards skin or other lipophilic tissues is more rather than its affinity towards kidney, heart, or highly perfused tissues. So, according to drugs affinity, it get distributed into different tissues differently in different concentration and different rates. Here, the parameter calculation of the parameter is very complex because every tissue we have to consider, and for each of that tissue we have to calculate parameter differently. This was all about compartment modeling. Here, the conclusion for compartment modeling is mainly three models we have used here: one compartment, two compartment, and multiple compartment models. But out of which one compartment is mostly used model because it is simple. Because here the body is assumed as a single compartment, parameters calculation is easy. Now, what are the application of all these models? Means if we are going to develop a drug, what is the application of these parameters which we have calculated or mathematically determined from these models? See, first application is characterizing the behavior of drug in patient. Means if the patient is having different physiology, different anatomy, or different level of enzymes, or different diseased conditions, then we can use ADME, absorption, distribution, metabolism, and elimination, to calculate dose for that particular patient. Means we can characterize a specific drug's behavior in different in that particular patient according to its condition, patient's condition. Second application is predicting the concentration of drug in various body fluids with any dosage regimen. Means here, with the help of these models in body, various body fluids, means in kidney, in heart, in lungs, or any other tissue fluid, we can calculate the we can predict the concentration of drug. Because as I already told you, as I already discussed, it is a mathematical model. These are based on assumptions, and only calculations we are doing here. We can calculate the concentration of drug in blood that is related to concentration of drug in body fluids. So with the help of these calculations, we can predict how much drug reaches to a specific body fluid, where it has to react, where it has to show its pharmacological activity. So this can only be performed with the help of models. Then third one is predicting the multiple dose concentration curve from a single dose experiment. Here, with the help of single dose experiment, we can depict a plasma drug concentration profile, which will help to understand how multiple dose concentration will react. Means we need not to do multiple dose concentration studies, only a single dose if we give to a patient and calculate the parameters. We can, using some equations, using some parameters or constant, we can calculate or determine the data for multiple dose concentration as well. And next one is calculating the optimum dosage regimen for individual patient. Optimum dosage regimen means how much frequency of a dose we have to use for individual patient. Means he has to repeat the drug in 4 hours, 6 hours, 7 hours, or 8 hours. That can be calculated only with the help of ADME, or absorption, distribution, metabolism, or excretion parameters or excretion pattern of that particular drug into a particular patient. Again, it is related to the patient physiology or patient's own disease condition or any other specific history. With the help of these parameters, risk of toxicity with a certain dosage regimen can be calculated. Because, as already in the second point, we have discussed that it can be useful for predicting the concentration of drug in various body fluids. Here, when we are predicting the concentration of drug in various body fluids, it will alert us about the toxicity level. We have also calculated in last slide, we have calculated Cmax with the help of these parameters. Cmax is maximum concentration of drug in blood. So Cmax, if it reaches to toxic level, when we are calculating these parameter, it will these parameter will alert us that it is reaching to its toxic level. Means toxic level also can estimated or calculated with the help of compartment modeling or these parameters. Now, the most important application, that is correlating plasma drug concentration with the pharmacological response. The plasma drug concentration that is directly proportional to pharmacological response means when the drug concentration will increase, obviously the pharmacological response will be increased. So, if we calculate all the parameters, plasma drug concentration, we can say it is directly proportional to pharmacological response. Here, this is the important tool or important parameter while we are developing a drug outside the body. Means while we are developing a drug into the laboratory, these plasma drug concentration profile or compartment modeling or calculations or all the parameter will tell us how much drug will affect pharmacologically, and this will also tell us how much means how much pharmacological response will be produced at a particular dose, or you can say it will tell us the minimum effective level, means at how much level the drug will exert its first effect, and toxic level it will also tell you, as it is shown in point number 5 also. Coming to the next point, that is evaluating the bioequivalence or bio inequivalence between different formulation of the same drug. Here now, as I have told you in the very first, when it's starting, that whether the drug has to be prepared in the form of syrup, solution, or tablet, or it is in the form of capsule. We can formulate two formulation of the same drugs, like we can formulate a tablet, like we can formulate a syrup also. Now we can compare effect of or parameters of these two formulation, that is called as bioequivalence, means biological, how much equivalence these two doses, different doses form shows, how much effect is exerted by how much concentration, or effect is exerted by tablet, how much concentration or effect is exerted by syrup, solution, or capsule, or any other doses form. This will help us to evaluate that which dosage form will be suitable, which dosage form will be most effective for a particular drug to bring it into the market. Next main application is estimating the possibility of the drug metabolites accumulation in the body. Drug means drug can accumulate into the body, or metabolites can accumulate into the body. Both are toxic to our body. So these parameters, see, if one parameter is saying that metabolism of drug is very less, excretion of drug is very less, or drug is not reaching, means drug's concentration in liver is less, then it is showing that drug get accumulated into the body, or its metabolite is getting accumulated into the body. So these parameters help us to assess these two indicators also, which are dangerous to the health. Accordingly, we can formulate or develop a dosage form. Now, these pharmacokinetic models determine the influence of altered physiology disease state on the drug ADME. If one person, suppose if one person is having ulceration in the stomach, Then absorption phase, that we have checked in a diagram. When the drug patient is taking a drug via oral route, it reaches to its stomach, and after reaching to stomach, it get absorbed into the bloodstream. Here first step is absorption, but if the patient is suffering from ulceration, then absorption will be fast. Means here the physiology of that particular patient is altered. Now the drug's absorption is changed. So these parameters tell us about change of the drug's parameters or change of the drug's ADME. Last but not least, explaining drug interactions. We are supposing that drug is going to its way and its ADME that we have calculated outside the body. But if the drug get interacted with some other molecule of the body or some other medication which we are taking simultaneously with the same medicine for which we are talking about, then there may be an interaction, and this interaction can only be predicted with the help of this ADME. If the ADME means, suppose we have taken two drugs simultaneously, one drug A and one drug B. When they reaches to our stomach, they get interacted and they form a complex. We are assuming that 90% of the drug reaches by absorption reaches to blood circulation, and B drug 70% reaches to blood circulation. But because of drug interaction, only 20% of the drug reaches to systemic circulation. That 20% drug will be an indicator that the drug get interacted in some way, in somewhere with some other drugs. So these drug interactions are also can be assessed with the help of pharmacokinetic parameters or these indicators. These are the application of compartment modeling. Before ending my today's session, I would like to conclude all these or the take home message for you all, that these four parameters, four major terms, that is called as absorption, distribution, metabolism, and excretion, play a major role in the development of a drug, and calculation of these four parameters is based on some mathematical approaches. One of that approach is compartment modeling. In the simplest way, compartment modeling is a tool or is a important tool or important method to calculate ADME, which contain a lot of parameters like first order absorption rate constant, volume of distribution, clearance, biological half-life, first order elimination rate constant, etc., Cmax, Tmax, all these parameters can be calculated using this compartment modeling. So this is the basic knowledge about these compartment models, or detailed calculation can also be used for calculating ADME or assessing ADME of a drug. Thank you once again, you all. Thank you for listening, and thank you for connecting with me for today's session. If anyone having any query regarding this, he or she can write in the comment box, and I will happy to answer you all. Thank you once again.